Now, in the pathophysiology of hypoglycemia, we will discuss about the different mechanism, how our body respond to hypoglycemia, and what are the different actions taken by the body to maintain that homeostasis. To keep the body in balance, our body can use different physiological mechanisms. So let's talk about different physiological reactions of the body to maintain this normal blood glucose level. So once the hypoglycemia is there, decreased glucose in the blood or decrease arterial glucose, then it acts on two very important organs of the body. One is the brain, and then we have the pancreas. Pancreas is the gland that produce insulin and glucagon, and both these hormones play a very important role in maintaining the normal blood glucose level. So decreased level of glucose in the blood, then in response to that hypoglycemia or decreased level, the insulin level is, or production of insulin is decreased by the pancreas. So there is decreased insulin and there is increase in glucagon. Insulin causes a decrease in the blood glucose level. So we need decreased insulin production to bring the glucose level back to normal, and glucagon is the hormone that causes increase in the glucose level. So in condition when there is hypoglycemia, we need increased glucagon level. So that's the normal physiological mechanism that brings the blood glucose back to normal, decrease in the insulin level and increase in the glucagon level by the pancreas. Now this decrease in the insulin, it has effect on both the liver and the kidneys, and this effect on the liver and the kidneys of the decreased insulin, it causes increase in the level of the glucose. And increased glucose level or increased production cause definitely bring back the blood glucose level back to the normal or close to the normal. Then we have glucagon. Glucagon function is mainly, again, it acts on the liver and it causes increased production of blood glucose level. Insulin is decreasing the glucose, metabolizing the glucose, and then glucagon is increasing the glucose and causes increased production of glucose. So both these, insulin is acting on the liver and the kidneys, causes increased level of blood glucose. Glucagon is mainly acting on the liver, causing increased production of glucose, which in turn causes increase in the blood glucose level. Next organ is the brain. In the brain, there is a gland or known as the pituitary gland. Pituitary gland is one of the master gland of the endocrine system. It has two lobes, anterior pituitary and posterior pituitary, and it produces different hormones which play a very important role in the maintaining homeostasis in the body. So this is the pituitary gland. When decreased blood glucose occur, it affects the pituitary gland, and then in turn pituitary gland produce two hormones. One is ACTH, adrenocorticotropic hormone, that acts on the cortisol cortex of the adrenal gland and produces the hormone cortisol. And then there is increase in the growth hormone. So adrenal cortex, this is the adrenal cortex, and it causes increased production of the cortisol hormone. So in the pituitary, decreased blood glucose level causes increased production of adrenocorticotropic hormone that acts on the cortex of the adrenal gland, cause production of the cortisol, and this cortisol in turn causes increase in the blood glucose level. Same with the growth hormone that causes increase in the blood glucose level. So this is one mechanism by which again there is rise in the blood glucose level. The other is by increasing the sympathetoadrenal outflow. This adrenal outflow, it acts on the sympathetic postganglionic neuron, and it also acts on the adrenal gland, which causes increase in the epinephrine level, increase in the norepinephrine, and increase in the acetylcholine. So on the brain, if you notice, we have two main mechanisms that work to bring the blood glucose back to the normal. One is through the pituitary gland, which cause production of ACTH and then growth hormone. Then the other is through sympathetoadrenal outflow, which act on the adrenal gland for epinephrine production, and then the sympathetic postganglionic neuron to increase norepinephrine and acetylcholine. And all these different hormones, they cause increased production of glucose. They help in the gluconeogenic process. They produce the precursors that help in the production of glucose, and they act on the muscle and fat for the production of glucose. So this ultimately causes increased production and increase blood glucose level. And the other mechanism by which they increase the blood glucose level is also by decreasing the clearance of the glucose. So it is more glucose is retained in the body and cause increase in the blood glucose level. Then there is also increased ingestion or intake of the glucose also that cause increase in the blood glucose level. So basically, if I just summarize this pathophysiology, we can say there are two main organs that play vital role in this gluconeogenesis or increased production of the glucose or bringing the glucose level back to the normal. We have the pancreas, then we have the brain. Pancreas, by decreasing the production of insulin and by increasing the production of glucagon, cause increase in the blood glucose level and reversing hypoglycemia. Brain, by pituitary gland, ACTH production, growth hormone production, and also by sympathetoadrenal outflow, which affect the adrenal gland and the post-ganglionic neurons, ultimately causing production of epinephrine, norepinephrine, and acetylcholine. So this is the pathophysiology or mechanism by which our body responds to hypoglycemia and try to bring the blood glucose level back to normal so we can avoid the consequences of hypoglycemia. So now if I just summarize the pathophysiology of hypoglycemia, or how our body maintain the homeostasis to bring the blood glucose back to normal. So once the blood glucose level is decreased in the blood, level of the glucose is decreased in the blood, two main organs play an important role. One is the pancreas, by decreasing the production of insulin and increasing glucagon level, and then we have hypothalamus in the brain that affects the pituitary gland and then increase the production of ACTH and then growth hormone, which both ultimately cause increase in the production of the glucose. And then also by the sympathetoadrenal outflow increase, which ultimately cause increase in the epinephrine, norepinephrine, and acetylcholine by affecting the adrenal gland, and also by affecting the postganglionic neurons. And all these hormones play an important role in increasing the blood glucose level and bringing it back to normal.